Hey, hello everyone. Let us continue our topic today with the complications of leprosy. So, what are the complications of leprosy? First of all, acute painful neuritis is a serious and dreaded complication and may result in the sudden paralysis. For example, claw hand paralysis, foot drop, facial palsy, etc. The joints may be involved in the reactional states leading to synovial swelling and even to the joint infusions. Lymphadenopathy is reported in 5% of patients and rarely even orchitis may occur. This is what we call as complication in the case of leprosy. Type 2 lepra reactions. What is the type 2 lepra reactions? Erythema nodosum leprosum, called as ENL lesions, are evanescent, painful, brightly erythematous, slightly raised nodules, distributed in a bilateral symmetrical fashions. They are multiple and commonly occur on the face of a human arm and on the thighs. The inner aspect of the thighs and flazes of the arm are favorite sites. So this is what the picture showing type 2 reactions of ENL. This is what we can see on the hand here. Next is complications. Iritis and epicleritis, rhinitis, epitaxis, pain and swelling of joint, and then periosteel pain. What is the periosteel pain? Especially in the tibia. The muscle pain we call it as myositis, painful dactylitis and tenosynovitis. Swollen tender lymph nodes, cyanomegaly, renal, it is proteinuria and renal failure. Penicutilis, frozen hands, then anemia. Later, the complications will be amyloidosis. Later, we have to do counseling of patients, search for precipitating factors, motivation to continue MDT, multiple drug therapy, and not to stop the treatment. Later, we have to do mild reactions. What are the mild reactions? We have NSAIDs with or without chloroquine. Chloroquine is what? It's a drug. For several reactions, what we have to do? Neurosis, ulceration, and impending paralysis will take place. The steroid will be drug of choice, prednisolone tapering dose. Later, 1 mg per kg body weight. Body weight should be 40 to 60 mg per day. Tapering of 10 mg per 2 week of interval, and then brief period will be from 3 to 6 months. The next we'll study what is multiple drug therapy. So the treatment according to WHO, multiple drug therapy in the year 1981, as you can see here in the pictures. PB, the adult blister pack. The next we have MD, adult blister pack. This is MB, adult treatment. This is PB, adult treatment. Later we have PB, child treatment from 10 to 14 years of children. The next we have is MB, child treatment from 10 to 14 years of children. Newer drugs. What are the newer drugs used to consume by the leprosy patients? Fluoroquinolones. We call it as ofloxacin, pefloxacin, sparfloxacin, temafloxacin, and moxifloxacin. Later at last we have sitagliptin. fluorescence. In the case of fluoroquinones. The next we have is tetracyclines, which is nothing but minocyclines. Macrolides, we have clarithromycin. Next we have ansamycin, which is rifabutine, rifapentine, and R76 bar 1. Later, dihydrofolate reductase inhibitors. We have bromimorphin, then K103. Later at last we have fusidic acid and beta-lactam antibiotics. So these were the newer drugs to in the case of leprosy. Next we have is disabilities and deformities in the case of leprosy patients. The disabilities in leprosy patients, there were 3 major stages. The first stage was impairment. Later we have activity limitations, and at last handicap. These were the disabilities in the case of leprosy patients. The primary impairments were thickening and nodulation of the skin and subcutaneous tissues, i.e. granulomatous infiltration. Later we have damage to peripheral nerves, is called as loss of sensibility, motor paralysis in the hands, on the feet, and on the eyes. The next we have is secondary impairment. Secondary impairments were ulceration, more serious damage to the feet and hands. There were injuries occurring from the unprotected use of sensitive extremities. Later, contractures in the fingers deformed due to the motor paralysis. Later, corneal ulcerations were there, consequent loss of visions, etc. were the secondary impairments. Activity limitations. The activity limitations were restriction or the lack of ability to perform an activity in the manner or within the range considered normal for the human being. The examples for the activity limitations were: first is loss of sensitivity in the hand. A leprosy affect a person experiences difficulty in the skillful use the hand at home and workplace. Food problems were like walking and running difficulties were the food problems. What were the eye problems? The eye problems in the case of leprosy patients were poor vision, restricting mobility, and later communications. So these are the example in the case of activity limitations. Next is, if in the case of handicap, inability to earn a living is a big problem. Social prejudice against leprosy, then dehabilitation, that was one of the problem. Later, destitutions. So this was the case of handicap leprosy patients. Next we have types of deformities. The types of deformities, as you can see in the picture here. Specific deformities, the local infection by Mycobacterium leprae, that was the specific deformities. Later, paralytic deformities, it was damage to the motor nerve, was called as paralytic deformities. Next we have anesthetic deformities, damage to sensory nerve, was called as anesthetic deformities. So these are the 3 types of deformities. The deformity in the case of face, lagophthalmus, facial nerve palsy, we call it as LMN type, we call it as facies leprosa. Then in the case of hands, ulnar and median nerve, claw, hand, median nerve, ape, thumb deformity, radial nerve, wrist drop, intrinsic plus fingers, frozen hand, then banana fingers. In the case of feet, common peroneal nerve, that is foot drop posterior tibial nerve, claw toes, and trophic ulcers. So these were the deformities in the case of leprosy patients. This is what, as you can see in the picture, claw hand with trophic ulcers you can see here. So this is what we trophic ulcer, claw hand with the trophic ulcer. This is resorption of digit in lepromatous leprosy, as you can see in the fingers here. We call it as resorption of digits. The next, lepromatous leprosy in the case of, this is what we call it as trophic ulcer, as you can see on the foot here. This is what we call it as trophic ulcer. Next we'll study about thermal burns in the case of leprosy. First is corneal opacity in lepromatous leprosy, as you can see in this picture. The next, eye changes in lepromatous leprosy. We call it as lepromatous pannus, as you can see in this picture. The next is management in the case of leprosy. The first is skin care. In the case of skin care, dryness will take place. So for that, use of oil, dressing for the deep cracks and infected wounds should be taken place. Later, physiotherapy is one of the treatment. Then splints, grippets, reconstructive surgery. So these are the what we call it as steps which is involved in the management of leprosy. This is what physiotherapy, which is showing the physiotherapy for the leprosy patients. The next we have is splints in the case of leprosy. Immobilize a part to relieve the pain, stabilize a joint, retain the joint or the part in a particular position after release of contraction, prevent its movement in a particular direction, and provide continuous granular stretching. This is what you can see. The next we have is feet deformities. So the first feet deformity is plantar ulceration, drop the foot, fixed deformities of the toes and feet. Later, at last we have tarsal disorganization. The next we have is plantar ulcers, as you can see in this picture. This is what we call as plantar ulcers on the foot. Indicate that the foot has some neural deficit. We call it as anesthesia or a muscle weakness. Next, let us come to the management of leprosy. How will we manage the leprosy? So first of all, for managing the leprosy, first step will be rest. Then mechanical cleansing with U-salt bath and irrigation, and the physical removal of the slough, confining surgery to drainage procedures. For this, the first step. The second step will be appropriate systemic antibiotics should be taken. Foot elevation. Later, plaster cast, protective footwear should be wear. Ulcer debridements, split thickness skin grafts. So guys, thank you for today. In the next class, we'll continue our topic with MCR footwear. Thank you.